Special guest in studio, he's a healthcare provider, he's an analyst of the ObamaCare rollout, and a political strategist. He's a dentist as well, Dr. Joel Strom. Doctor, welcome to the program.
Thank you for having me.
Nice to see you here. I wanted to get into this whole business about doctors because as I was listening to the guy from Heritage, Bob was talking about, well, there's going to be a lot more people being taken care of through Medicaid, which in California is called Medi-Cal. There's going to be a lot more people in these exchanges getting subsidized to buy health insurance that maybe were not able to afford it before, and the pre-existing condition thing goes away, so people will get their insurance. But it implies to me that there's going to be possibly millions of more people seeking medical help from some kind of healthcare provider when I don't see the numbers of those healthcare providers expanding. In fact, doctors are telling me they're retiring early rather than go through all this complexity. And that I saw a national story that the rate of bankruptcy, which is low, but it's still rising among physicians, which is also a startling figure as they try to cope with reimbursement from insurance companies and the awful Medicare delay, 8, 9, 10 months of trying to get reimbursed. So from your point of view, first of all, is there going to be enough doctors to handle all this demand?
Well, the short answer is no, there's not. The plan did not anticipate, I don't know why it didn't anticipate this, but you can't add 30 million more people to the insurance rolls, public or private, and not add any more doctors. It's just not going to work. It's a simple math problem. Whether people support the idea of Obamacare or whether they don't support the idea of Obamacare, there just are not going to be enough providers.
Well, it's an interesting place to start, but even beyond that, and I think maybe worse in your point of view, Dr. Strom, is the idea that the relationship between the professional doctor and patient, which goes back a couple thousand years, where the care, and it's so unique to that person, and it's so much of a personal relationship, is shattered by ACA, right?
Oh, tremendously so. Opponents will say that insurance companies already do this, but this takes it to another level. I mean, imagine telling Picasso or Van Gogh, we love your painting, you know, you're brilliant at what you do, but you know, we're going to change the brush that you use and the paints that you use, and we may even tell you how thick the paint should be. I mean, you're taking away the art from the science. In healthcare is an art based upon a science, and the art comes in when your doctors, using their knowledge from science, are able to mesh that with the art of treating the individual patient. And that will no longer be the case under Obamacare.
Talk about that in some detail. When you say no longer the case, give me an example. What do you mean?
Well, in healthcare, you know, patient walks in the door and they have a problem. They may have a chest pain. And many times the doctor may say, you know, it just doesn't quite seem like it's a heart problem to me. I think it's gastric distress.
Right.
Well, under Obamacare, there will be a whole set of rules, which I don't even know what they are yet, because the regulations you showed earlier in your show,
yes,
20,000 pages, I think there's going to be 100,000 pages. So I can't speak to what's going to really happen, but they're going to have to consult a guidebook, you know, a paint by numbers type of thing, to say, where do I send this patient? Do they go down in door B or door A? There'll be a lot more of that in the future, where the doctor will not be able to go out on his or her own to make some choices about what to do with your chest pain versus someone else's chest pain.
Now, you're a dentist, and you mentioned the dentists are also having even more difficulty with this thing than physicians.
Well, for dentistry, it's more the fear factor. You know, in the law, it's stated that all children will be covered for dental services, but they haven't defined that yet. So here we are, just months away from the deadline to implement Obamacare fully, and we don't even know what that means. They haven't defined that for us. And additionally, the law also stated that all dentistry may be covered in the future. That was a decision that was supposed to be made almost 2 years ago. So it's a cloud hanging over the head of dentists to how do we plan our business? How do we make our practice go? Who do we hire? How many people can we hire? Do we still take insurance or not?
Doctor, you've been active with a couple of different governors, I know, of the state of California,
yes,
advising them on a variety of things. In terms of the Concern California, the rollout of our exchange here in the state of California was probably the most advanced in the country because the state legislature spent over $135 million trying to roll this thing out and make sure on October 1 it's ready to go. How are we doing in dentistry in that? I mean, they're dependent, as you said, on federal regulations to tell them what to do. But in California, they appear to be trying to lead the federal government in being able to come up with something that actually works on October 1st.
Sure. I mean, the general answer to your question is yes, we're ahead of the country in most every phase of that. And the California Dental Association, which I have been a member of for many years, is working hard as best they can with the state to streamline the applications and understand what this all means. It's still, to me, at the point where we don't really know what we have to do. And our dentists in California are really uncertain of which way they're going to go.
Now, when I was, and you and I were both watching and covering and talking about the debate, the political debate leading up to the, what was it, Christmas Eve night vote
yes.
on Obamacare, and then subsequently in March of 2010, the signing of it by the president. In all of that debate, very few physicians were involved in the debate. Very few people who ran hospitals were involved in that debate. Very few nurses were involved in that debate because Congress doesn't have those people. You had a whole bunch of lawyers talking about what health care ought to be. It must have been very frightening.
I was very frustrated because I've been aware of this. I've been involved in political campaigns for many years. And there's a dearth of healthcare professionals involved in politics. And when they do get involved, they tend to get shuttled off into a healthcare coalition. And the healthcare coalition invariably is more window dressing. They give some speeches, talk about how this governor, that governor feels about healthcare, but they're not really involved with policy decisions. And I was struck by the fact that there was a total imbalance in our at the federal level. There's about 3.7% of all Congress are healthcare providers of any stripe.
So their voice really wasn't heard in developing these policies.
No, and the mistake that many people, especially healthcare providers, make is that when you go into the room as a member of the AMA or the ADA or any organization, you're seen as a lobbyist. Yeah. You may think you're above a lobbyist, but that's how you're viewed.
You'd like to see a lot more doctors run for Congress.
Oh, definitely. That's why we started.
Got 1 minute. Tell me about it.
That's why we started doc squads. We said, you know, we got to get more doctors involved. If there's going to be change, they have to be in the room, making the decisions. So we founded a group called Doc Squads. Its job was to identify, to recruit, train, and organize these guys and women to go out and run for office. And we've got about 19 states, presence in 19 states. We've done about 2,000 events. Our doctors are out there now, kind of ready to go into the political process, and we hope we can continue that moving ahead, because there have to be doctors in the Congress, and they have to have enough numbers to be able to move votes.
Amy Barra is a physician from Northern California,
yes.
right?
Yes.
And the congressman said, wait a minute, slow down here. This doesn't make any sense to me. Finally, he's waking up, even as a Democrat, to some of the problems.